Before Caretaker, we were doing manual vitals, meaning nurses would periodically go into a patient's room and take blood pressure and so forth, and that was unfortunately problematic for our treatments, which not disturbing a patient is really very, very valuable and a primary point of what we try to setting we try to create. So it was highly suboptimal, and in fact, it was becoming quite an issue with each of our patients. It was pretty typical for us to have to go through negotiations with them. They would be asking for no blood pressures. Or when that was off the table, can we reduce the frequency of the blood pressures because they clearly were experiencing it as a detriment to their experience. And in this type of treatment, the experience of the patient plays a role in the outcome. So we were faced with a dilemma. On the one hand, we wanted to keep patients safe and be able to monitor their vitals and blood pressure. On the other hand, we also knew that came at a cost in terms of the patient experience and therefore the ultimate therapeutic effects. And so having kind of facing this every time, with every patient, this pushback about getting those blood pressure and vitals, I started to look for alternatives. Is there something out there where we could get this information but not have to, intrude and open the door and pump up a cuff and so forth? And I came across Caretaker, and I thought this could be just what we were looking for. I think that with time, we've become more and more confident in the Caretaker and its accuracy, in its reliability, and I think that's reflected in the fact that we started off sort of tentatively with one device to test it out. We're ready to jump in with both feet yet, and then when we saw what a remarkable asset it was and how reliable it was, but also solving that problem of intrusion, we purchased more and more of them because we do simultaneous treatments in our clinic, and so now we have units to cover all our patients, and in fact recently we have purchased Caretaker to address the needs of our research patients who have the same kind of requirements of minimizing intrusiveness in their treatment. So it's definitely become an integral part of our paradigm for the clinics. So there is a setup process that's required, initially in terms of fitting the Caretaker and doing the calibration, and our nurses usually do that very seamlessly as part of the greeting. They room the patient, and then they're getting an update from the patient on how they've been while they're setting up the Caretaker. So it's really not adding to any visit time, because that time would have been spent with the patient, sort of getting the clinical information update, and the nurses are able to easily set it up while they're talking to the patient. And then comes the great time and efficiency saving, because nurses are not needing to to keep tabs of time, so to enter patient's room at the appropriate time to get another point vital measurement, and so that really liberates, I think, the nurses in terms of having to keep an eye on the various timers that to kind of track when the next vital blood pressure measurement needs to take place. And then what's remarkable about all this, the patients not only get this enhanced experience because we're not intruding on their experience. The nurses are not only not needing to keep track of the time and then to run into patients' rooms and do that, so it frees them up. But on top of that, we're actually getting more clinical information than we were before. We're not getting a single time point every 15 or 20 minutes. We're getting continuous, and then we can even import it into the chart very easily, and has now a function of creating a summary report. It's a win-win all the way around. I think Caretaker has become really an integral part of our setting, and in ketamine treatments, like psychedelic treatments in general, because ketamine treatments are a form of psychedelic treatments at the doses that we give them. There's a concept called set and setting. Patient's mental state coming into the treatments plays a big role in the experience and in the outcome. And the setting, meaning how conducive it is to facilitating that, also plays a very important role, not only in the patient experience but then in the outcome, the therapeutic outcome. And so Caretaker, we spend a lot of energy optimizing the setting so that patients can experience the ketamine-induced phenomena, the psychedelic altered state of mind that they experience, and which is so therapeutic. And so we spend a lot of energy optimizing that, and a big part of that is to allow them to not be disrupted during this. And Caretaker solved the last big hurdle we had to doing that, which was finding a way to be able to obtain important clinical information from patients, their vitals, without undermining all the other efforts that we did. And so, really, with the introduction of the Caretaker into our practice, all the other efforts that we did were able to come together, and all the and their potential was fully manifest because of that technology. So it's just part and parcel of our treatment. I can't imagine us going back and having to go in and take blood pressure. It was a really interesting confluence of events, because ketamine was a very new kind of paradigm in medicine, and at the time, I was running the only ketamine infusion program really that existed anywhere. So we were creating a lot of the core qualities and characteristics of these things. And we had this unmet need about being able to take reliable blood pressure and other vitals without disrupting the setting paradigm that we spent so much effort in optimizing. And we didn't know what kind of solution there was to this unmet need, because clearly it was a problem. Patients were displeased with the standard way of us going into the going in and disrupting them with standard blood pressure, manual blood pressure. At the same time, Caretaker was developing this. Caretaker Medicine was developing the Caretaker product for other needs, medical needs, hospitals, and so on. They never imagined what a great match it was for this new treatment that was being, was evolving and being developed. And when I reached out to Caretaker and purchased the first unit, and they were asking me about the use, I could almost hear, the silence on their side when I explained that, we're giving it this drug off-label to create this, kind of psychedelic-like experience, and it was something they never imagined. But when I explained why, it seemed like such a natural, such a natural fit for Caretaker. But I think it's kind of interesting that we had this unmet need, didn't know what the solution was. Here was the solution, didn't know that there was a problem out there that it matched so perfectly for. And I think it's very interesting and gratifying to see how other ketamine clinics that have been established since that time have followed suit and have seen Caretaker as almost as a required a piece of equipment if you're starting a ketamine clinic. Two groups working on different things, never realizing that they were creating a perfect, harmonious solution to optimize treatment.